Welcome to this explainer. Today, we're diving straight into a massive, high-stakes medical crisis that, believe it or not, hinges entirely on just one missing microscopic element in premature newborns. We're talking about neonatal respiratory distress syndrome, or NRDS for short. It's this incredibly dramatic biological cascade where the absence of a single substance triggers a system-wide physiological crisis. But, as you'll see, it is also an absolute story of medical triumph. Let's get into it. Here's a quick look at our agenda for today. First, the premature lung problem. Second, the physics of lung collapse. Third, spotting the clinical signs. Fourth, inside the damaged alveoli. And finally, number 5, life-saving treatments.
All right, kicking things off with Section 1, the premature lung problem.
60%. Just pause and think about that for a second. Before modern interventions came along, that was the historical mortality rate for neonatal respiratory distress syndrome in developed countries. Today, it still remains the leading cause of illness and death in premature infants. About 1% of all neonates develop the syndrome, but the risk is heavily tied to gestational age. In fact, for babies born at less than 28 weeks of gestation, more than 50% are going to face this condition.
So, what's at the heart of this crisis? It all centers around our main character, surfactant. You can kind of think of it a bit like dish soap. Its absolutely vital job is to maintain a delicate pressure balance at the air-fluid interface. This is what prevents the tiny air sacs in the lungs, the alveoli, from collapsing. The crucial takeaway here is that a deficiency in this one single substance is exactly what triggers the entire downward cascade of the disease.
Moving right along to Section 2, the physics of lung collapse. To really understand why missing surfactant is so completely disastrous, we have to talk about physics, specifically Laplace's law. This states that pressure equals 2 times surface tension divided by the radius. Now think about the last time you tried to inflate a really stiff, brand new balloon. It takes a massive amount of pressure just to get that first bit of air in, right? Well, surfactant's job is to lower that surface tension. Without it, the pressure required to keep those tiny alveoli inflated becomes incredibly high. And for a tiny, already exhausted premature newborn, trying to maintain that kind of pressure is just a physical impossibility. The lungs literally just collapse.
Now, there's actually a fascinating biological timeline for when it becomes safe for a baby to breathe on its own. Before 28 weeks, the fetus is primarily producing sphingomyelin, which is a non-pulmonary lipid. That means the risk of NRDS is extremely high. But right around the 30-week mark, things shift. Production of mature surfactant, a phospholipid called lecithin, starts to catch up, giving us a 1-to-1 ratio. Then, by 35 weeks, lecithin production absolutely surges, and the ratio hits 2.0. At this point, the risk of NRDS just plummets. On the flip side, if medical tests show a ratio under 1.5, that is a very strong indicator the infant is going to suffer from the syndrome.
Okay, let's jump to Section 3, spotting the clinical signs.
When a baby is born before that mature surfactant is fully ready, the symptoms show up incredibly fast. We're talking within minutes, or at most up to 24 hours later. You'll see the infant physically struggling against their own collapsing lungs. Doctors look for cyanosis as oxygen saturation drops below 90%, and tachypnea as the baby desperately breathes over 60 times a minute with a really erratic heart rate. The physical effort is just immense. There's nasal flaring, the chest walls suck inward, and there's this heartbreaking audible expiratory grunt. That grunt is actually the baby instinctively trying to keep their own airways open against all that pressure.
Inside, this visually translates into what medical professionals call a ground glass appearance on an X-ray. That gritty, diffuse texture you see across the lungs, that proves the normal air content has been completely replaced by protein and edema. When doctors see a premature baby in respiratory distress and the X-ray has this specific presentation, they know surfactant replacement has to happen immediately. No time to wait.
Which brings us to Section 4, inside the damaged alveoli.
The domino effect basically works like this. Step 1, decreased surfactant, leads straight to Step 2, increased surface tension. That tension triggers Step 3, widespread atelectasis, which is just the medical term for alveolar collapse, and that inevitably results in Step 4, dangerous hypoxemia and acidosis in the blood. So this initial mechanical failure of surface tension is the spark that spirals into a massive systemic crisis. Tracing this cascade a little further down the line, that hypoxemia and CO2 retention lead to acidosis, and that forces the pulmonary blood vessels to squeeze shut.
This severe lack of blood flow causes massive cellular damage to the endothelium and epithelium. And because of that damage, plasma starts to leak straight into the alveoli, creating something incredibly dangerous, the hyaline membrane. Under a microscope, the grim reality of that membrane becomes super clear. You can spot these light pink staining layers lining the air spaces. That right there is the hyaline membrane. It's a literal biological spackle made of fibrin and necrotic, dead type 2 alveolar cells. They create a solid physical barrier to diffusion. So not only are the infant's lungs collapsing, but this pink membrane actively blocks whatever oxygen they do manage to inhale from ever reaching the bloodstream.
But, fascinatingly enough, prematurity isn't the only cause here. Deep inside the alveolar cells, abnormal opaque lamellar bodies can sometimes form. Very rare genetic mutations, specifically an autosomal recessive deficiency in surfactant protein B, can also cause NRDS. In these cases, the body basically traps its own surfactant inside these abnormal cellular structures, rendering it completely useless, even if the baby is full term. Finally, let's get to the good news in Section 5, life-saving treatments and outcomes. Today, we actually have a highly sophisticated toolkit to fight this. Proactively, doctors can administer corticosteroids to the mother to stimulate the fetus's own surfactant production. Reactively, we use continuous positive airway pressure, or CPAP, to mechanically push the baby's lungs open. We even use caffeine to jumpstart their respiratory drive. If CPAP isn't enough, mechanical ventilation is brought in, and the absolute game changer, exogenous surfactant. Delivering artificial surfactant directly into the infant's lungs within 60 minutes of birth can instantly begin lowering that surface tension.
Now, managing NRDS is a very precarious tightrope. On one hand, you have the disease complications. The hypoxia itself can lead to severe neural development issues or dangerous intestinal inflammation. But on the other hand, the treatments have their own severe complications. Uncontrolled oxygen therapy can cause toxicity that permanently damages the retinal arteries, and the mechanical ventilation required to literally save their life can physically rupture those fragile lungs, causing air leak syndromes. But here is the ultimate narrative payoff: 98%. Remember that 60% mortality rate we talked about at the beginning? Today, despite that terrifying biological domino effect, and despite walking that razor-thin tightrope of complications, survival rates can reach up to 98% with advanced medical care. Antenatal steroids, precise respiratory support, and exogenous surfactant have absolutely revolutionized the prognosis for these vulnerable infants.
So, I'll leave you with this provocative thought. As medical science pushes the boundaries of viability, rescuing infants born earlier and earlier in gestation, how will we continue to perfect the delicate balance of replacing what nature has yet finished building? It's a profound question, isn't it? It highlights both the extreme fragility of life and the relentless ongoing triumphs of neonatal science. Thank you so much for joining me for this explainer. I hope it sparked your curiosity and really clarified the incredible mechanics of the human body. Keep learning, and I'll catch you next time.